Hi, I'm Joe, a fourth year medical student, and I applied to Newcastle University through the Partners Programme. Throughout your time at medical school, the two main areas that you will work on is your knowledge and your experience. In terms of knowledge, there can seem to be quite a lot that you need to cover in medicine, but it's really interesting to find out about all the different body systems and what happens in both health and disease. And in terms of experience, you get this through your clinical placements, be that at hospital or GP or other settings. And it's great to see patients from a wide variety of backgrounds, as well as shadowing doctors and other healthcare professionals and learning from them. I'd say the main three challenges I found of medical school has been firstly the sheer breadth and depth of knowledge that you seem to have to shove down into your brain each year, and it's quite daunting, but over time you start to feel like things are more familiar and you build on what you've learned in the years before. Another thing is the workload, which typically is a lot more intense than other courses that you might do at university. However, it is possible to manage to keep a good work-life balance, and I've personally done that through joining some university societies. So I play trombone in the University Jazz Orchestra, for instance, and that's a great way as well to meet friends outside the course and the wider university. Also, exams generally are something that cause medical students a lot of stress, and unfortunately, that is a reality of both medical school and medicine as a career. You'll constantly have exams on the horizon, but I guess the thing you can take away from that is that they are there to help you learn and help you to get feedback on what you're doing and become a better doctor at the end of the day. But there are so many more positives of med school. You see such a wide variety of people, and it's really interesting just to get to know people. It's really insightful to hear different people's backgrounds and personal stories, and that's true of patients, but also the staff as well as your fellow peers. And there's always something new to learn in medicine. You never kind of feel like you've covered everything, and that's nice. That's quite exciting as well. And it can be a really rewarding career too, especially when you feel like you've helped contribute to patients' care and perhaps put a smile on their face or really kind of help the clinical team with an issue they were having. And that can be really rewarding as you go through. So for me, I didn't know any doctors personally, and I came from quite a low income family background. I was a young carer for my younger brother, who has multiple health conditions and personal care needs. So it was quite a challenge growing up, but I think from that, I realised that I quite enjoyed the rewarding role of looking after someone else. I also was able to go to quite a few hospital appointments with my brother, so was exposed to healthcare through that. And I was really interested in the sciences at school, particularly human biology. So from that, I started to think maybe medicine might be something I should look into. So I went along to some Newcastle University events, to the mini medical school lectures and a widening participation conference. And from those and chatting to medical students, I kind of got an idea of what medicine might be like and decided that it would be something I'd be interested in. I got some work experience that reaffirmed that. And so I was pretty set on applying to medicine in sort of the middle of year 12. I then applied to medicine through partners after discovering that I was eligible for that. And there are two main components to partners. The first is the reduced offer. So instead of needing to get 3 A's at A level, that reduces down to 3 B's. So as you can imagine, that took a lot of the pressure off for the leading up to exams. But I'd say the main value I got out of partners was probably the summer school. It was a chance to, go away from home for a week, live in university halls of residence, and go to lectures, meet the lecturers, experience what medical school was going to be like. And I think that really just helped. I really enjoyed that. I found it was a really useful experience, and it definitely helped kind of calm some of those anxieties about starting university in September. So would really recommend partners, and they've helped support me as well throughout my studies. They pointed me towards becoming a student ambassador and part-time work opportunities through there. So I've worked on campus on different events and also helped on some partners summer schools and other events that the university has run. And that's been great to kind of develop some skills, to meet lots of different people, and also to get a bit of part-time work in and get some money into the bank account, because that's the reality of living off a student budget. So for the first 2 years of medical school, you'll spend the majority of your time on campus, going to lectures, to seminars, learning about anatomy through cadavers in the dissection room, also clinical skills sessions where you'll learn how to talk to patients, how to ask questions and examine them for a wide variety of problems that they may come in for. Also in the first 2 years, you do get some clinical exposure. There's some day visits scattered throughout at both the hospital and GP. In third year, it's your first clinical year. You spend the majority of your time in hospital. You'll have teaching as well as time on the wards, in clinic and in theatre. You'll also go through rotations of medicine, surgery, as well as women's health, child health and mental health. At the end of third year, you'll have a student selected component, which is basically a 4-week placement where you decide where you want to go. So if there's a speciality that you're interested in, or there was a consultant that was really approachable and you found you learned from them, you can look to follow them in a 4-week placement. In fourth year, so where I'm at now, it's very much a mixture of lectures and clinical placement. So throughout my week, some days I'll be going through online learning and others I will be on placement, either GP, surgery or medicine. I have half a day a week in each of those. We also have a panel of patients that we follow up, so you get to see their journey through whatever they're going through in terms of their health, which is really interesting, and you learn quite a lot from that and what it's like for a person to live with a condition rather than just what it might present as seen in the textbooks. At the end of fourth year, you have another SSC, a student selected component, and then you have the elective, which many see as a highlight of medical school. It's essentially an extended placement, which is abroad, or it can be in the UK, and it's a chance to see a different healthcare setting, different healthcare system, as well as experience the joys of somewhere else in the world that you may not have been to before. For fifth year, the focus is very much getting you ready to be a junior doctor, so you'll spend a lot of your time in hospital, just ready to learn to be that person that medical students come and ask questions rather than the other way around. Also, at Newcastle University, we offer an intercalation year, which you can take at the end of years, in between years 2 and 3, or in between years 4 and 5. And this is essentially a standalone year degree that you do within your time at medical school. And you could do that in a research project or just another topic, another field that you're interested in. As a doctor, it's a privilege to be able to look after and help people in moments of their life where they may often feel the most vulnerable and scared. You are that person that provides reassurance to them and helps make sure they get the best quality of care, working within the healthcare team as well as with patients to decide the best management plan for them that's going to help them get better or help them lead the life that they want to live. Also in medicine, it's a career of lifelong learning, as well as quite a secure and well-paid job. There's a wide spectrum of specialities that you could go into, so there's definitely something for everyone within medicine. And there's lots of opportunities for teaching and research as well, if that's something that interests you. So thank you for listening, and I hope that this short talk has been helpful for you and that it's given you the chance to think about whether a career in medicine might be for you. Thank you.